Oh, you're going to have to unmute yourself, Ruth. I muted everyone.
Okay, there we go. Hello, everyone. Welcome to this presentation by Christina Rusi on the 211 service that's available in our area. Christina is with the Glasser-Schonbaum Human Services Center, but she has 15 years of experience all total with the 211 service in the various roles that she has had in service to our community. So she's obviously thoroughly knowledgeable and will be able to provide us actually an inside view. So Christina, I'm going to turn it over to you.
Thank you, Ruth, so much. And I would like to thank everyone present today for this gift of your time to highlight 211 and give this service a voice. Probably the most often asked question is, what is 211? 211 joins what we call the N11 group codes that are used to provide 3-digit dialing to special services. 211 helps to ensure that people in need are connected to agencies that can help them. On the national level, the FCC has declared 211 a community essential service. It takes its place amid other 3-digit numbers we know and may use. There is no 111. 211 is community information and referral services for health and human services. 311 is for, like in Manatee County, governmental services and non-emergency police services. 411 is your local directory assistance. 511 is traffic and transportation information. 611 is for repair services. 711 is for the hearing impaired. 811 is if you want to dig a ditch. And 911, probably the most well-known of the N11 numbers, and hopefully one that you don't ever have to use, is 911 for emergency services, life and death services. In July of 2022, we will add a new 3-digit number. It won't be part of the N11 numbers. There weren't any left in the sequence, but it will be a 3-digit number. It will be 988. And that easily used 3-digit dialing system will be for suicide prevention. It will be the National Suicide Prevention Lifeline number. Prior to this, the Lifeline had a toll-free number considerably longer, and now we've established this 988 number for emergency services. 211s are mandated to give information and referrals on basic human needs, physical and mental health resources, work support, support for elder adults and persons with disabilities, children, youth, and family services, disaster services, suicide prevention assistance, and access to services in non-English languages. So every 211 across the United States has a translation line, which typically offers services in 157 different languages. From data retrieved in a 2018 survey, 94.2% of the population in the United States has access to a 211 system. This is a free service. There is no charge to the end user. It covers all 50 states, the District of Columbia and Puerto Rico, is available to approximately 309 million people, 94.6% of the population. In that same 2018 survey, 211s had offered 12.4 million connections to help, 1.3 million connections to financial assistance and coaching, 13 million website searches for assistance, and 4.3 million connections to address and prevent homelessness. Those are just a few of the stats that that particular survey was able to isolate. As some of you may know and some not, the 211 Contact Center was part of the local nonprofit landscape in Sarasota starting in 2004. We had 2 offices, one in Manatee and one in Sarasota, which later merged to one office, and then later after that, DeSoto County joined. So we have a tri-county area of DeSoto, Manatee, and Sarasota counties. In 2017, that local presence ended, and the 211 Funders Collaborative was formed. That collaborative's members are local county governments, Manatee and Sarasota, and the United Ways of Manatee, Sarasota, and South Sarasota counties. There was a decision made to contract with 211 Heart of Florida United Way in Orlando to cover our tri-county region. Our contracts with 211 Heart of Florida right now are renewed yearly, and perhaps in the future that may increase to 2-year MOUs or memorandums of understanding. The national network is comprised of 240 centers throughout the United States. The Alliance for Information and Referral Systems oversees 211 operations throughout the U.S. There are 27 AIRS standards and quality indicators for professional information and referral, covering every aspect of the information and referral operation that 211s must follow. 211 centers take approximately 35,000 calls per day. And that number would, of course, increase exponentially in a disaster or a weather event, or as we have seen now, the last 16 to 18 months in the pandemic. The Florida 211 system is comprised of 14 contact centers. And by Florida law, Florida statute, each center must be accredited to operate in the state. Accreditation happens approximately every 5 years and takes anywhere from 12 to 16 to 18 months. And the Alliance, better known as AIRS, manages that process. The 211 Heart of Florida United Way that serves our region serves 22 counties in the state in total, of course, 3 of those being ours. They have approximately 45 staff to man the operation of the service. Also, in times of disaster, there are trained volunteers to augment the manpower required to meet the needs of the community. All primary staff must be certified in their work within a certain time frame. Our local 211 system averages right now, according to the stats that I received in our last fiscal update, our quarterly update, about 2,008 calls per county, meaning Sarasota and Manatee, per month. And a total for the 3 counties of approximately averaging 709 text, chat, and emails, with over 931 online website searches per month. When we made the transition to a partner 211 in 2017, it was the request of the 211 Funders Collaborative that our tri-county region have its own local website. And every day, hundreds of people across our tri-county region of DeSoto, Manatee, and Sarasota counties turn to 211 for information and support. The mainframe of the site is the link to the 211 resource database. 211 Heart of Florida is mandated by AIRS to update the 211 database annually to ensure accurate information. Each agency is given its own unique username and login to edit changes directly on the 211 platform as they occur. So all of our agencies have access to organizational profiles 24/7, 365. The database is indexed using the 211 LA taxonomy of human services. There are 9,000 codes within that controlled vocabulary. The 211 LA taxonomy is to the information referral field what the Library of Congress catalog system is to libraries nationally and internationally. It allows all information and referral providers to speak the same language, classify information consistently, and to share data locally, statewide, regionally, nationally, and internationally. And this ability to transfer data is extremely important in the face of perhaps a weather event. We're in the midst of hurricane season right now, and hopefully we don't see any in our region, but we came kind of close just a few days ago. Most 211s in the United States have a buddy 211, a 211 contact center where they could actually transfer their entire phone system and all of their disaster resources in the database to another area. And I'll give you an example. When we were local, Hurricane Irma was here, and we knew that we were going to have to evacuate the building. And that meant at that time, we didn't have full services remote. So we had a sister city, 211 Tampa Bay Cares and Pinellas, and they took over our phone systems regularly from 5 in the evening until 8 in the morning and weekends. And when we knew that we had to evacuate, we sent our resources, our disaster resources and our local information, and we switched over our phone systems as we would typically every evening to them. It came to pass that they also had to evacuate their contact center. So they took all of their data, disaster information, our disaster information, and switched our phone systems and their phone systems to 211 Los Angeles. And 211 LA answered our calls here locally and in the Pinellas, Clearwater, Largo area until we were able to get back into the office. So that's one of the reasons why this consistent sort of platform for data information is extremely important. So that the next agency who may be very far away from where you are can actually read the information, understand the information, and then give it out to callers and contacts as they come in. 211suncoastcares.org is our website. There are currently 277 agencies that have their primary location in DeSoto, Manatee, and Sarasota represented in the database. Those 277 agencies include an additional 231 sites. The agencies and the sites together provide over 1,200 programs in our region. On the 211 Suncoast Cares site, there's a Search for Services tab, which directs you to the 201 Heart of Florida United Way Community Resource Directory. And I just received an email this morning and haven't had time to go over all of the details, but 201 Heart of Florida has been looking at sort of a revamp, a remake of their webpage for search. So I haven't had a chance to actually review that, but that's a very important piece of the puzzle, especially for those who would like to do a personal online search at home, maybe sitting at home with a concern or a worry, and they can go online and start to look up resources for their community on their own. Services can be searched by keyword, by agency name, or guided icon search. There are specific, very specific guidelines, a style guide, if you would, of mandatory data elements for every service that's entered into the resource directory. Once again, one of those reasons being that if we ever have to transfer information elsewhere, then the mandatory data elements are consistent throughout the country, so that the information that needs to be there is there. There are recommended data elements as well for a resource database, but it's the mandatory elements that are most important when we have to do transfers of information. 201 Suncoast Counts. This is a very interesting dashboard that any of one of you can utilize at any given time. If you go on our 211 website at 211suncoastcares.org, you will find a button that will allow you to get on the 211 Counts dashboard. It's the first tool to provide real-time, searchable, and visual presentations of data from 211 contact call centers across the nation. Using 211 Counts, you'll find a snapshot of community-specific needs displayed by zip code, region, or call center as recently as yesterday, enabling you to easily check trends, make comparisons, and share information. 211 Counts works with your local 211 to share this information with community leaders and service agencies. 211 Counts was created by the Health Communication Research Laboratory at Washington University in St. Louis. When we were in business locally, we were asked to be one of the pilot programs for this dashboard, along with North Carolina. There was a very special grant, the William R. Keenan Jr. Charitable Trust, that was able to produce this dashboard. And 211 Counts has expanded across the United States. The dashboards have been used to write grants, create up-to-date reports, and show evidence of community need. While 211 Counts includes 211 systems as its users, the primary audiences include government representatives, service agencies, and philanthropies. "211 is powered by people. It's a service that provides expert caring, empathetic, non-judgmental help. 211 meets real needs in real time, and it has a unique pulse on regional needs. 211 tackles underlying root causes as well. Specialists are trained to identify root causes of a problem and connect residents with a wide range of available resources that meet all underlying needs, not just the one that prompted the call, the text, or the chat. During my course of service in the 211 contact center, and where I wore a number of different hats, had a lot of conversations with a lot of our residents in the Tri-County region. And oftentimes people will be calling for perhaps assistance with a water bill or assistance with a light bill, but the true reasons for the need are underlying. And 211 contact resource specialists are prepared to do a non-invasive probe to try to make sure that we're covering all the bases for a family when they call. We can't meet all the needs perhaps in one short call. Our contacts, our residents are always encouraged to call back with additional concerns, or if we need to repeat the information, as often as it takes. A lot of times people don't come to the contact, to the phone with anything to write with. Now that we do most of the work in text, it makes it a little bit easier. Resources and information can be directly texted to someone's phone so that they can store them and utilize them at a later date. 211 is an extremely vital service in our community. It's not always fully understood, but it's been here for quite a while, and it continues to give a great service. We've been able, over the course of the last 16 to 18 months, have direct contact with 211 Heart of Florida for our area. In situations like this, we utilize a static database, the one that's updated yearly, but we also use what we call whiteboards or Excel spreadsheets, or in our case, information via email back and forth, in order to make sure that the very flexible, very changing times are indicated in our resources. So we've been able to email 211 Heart of Florida multiple times a day over the course of these last 16 to 18 months to make sure that they had all of the information they needed as our organization sort of revamped, addressed the concerns and the barriers that they had for their staff and for their clients, and to go virtual, to go digital, to learn how to use Zoom and Microsoft Teams. And there's been a tremendous exchange of information over the course of these last months in order to keep our residents updated on information for health and human services that have been available to them. I would like to thank all of you today for your time and attention and giving me this opportunity to speak about 211. And I'm happy to engage as best I can. Any questions? This is my information. If anyone would like to contact me, you can utilize the information that's on the screen now. And I will send the PowerPoint to Ruth so that she has a copy of that if she needs to share with anyone. I'm happy to take any questions now if anyone has them.
Well, we actually have 3 questions now in the chat. So Christina, the first question is, early on you mentioned that there are some trained volunteers to help out at 211 in times of extraordinarily high volumes of requests. If anyone is interested in volunteering, how do they go about beginning the process to become trained, to make their interests known to you?
Now that we don't have a local presence and all of the work is done through our 211 Heart of Florida in Orlando, it becomes their sort of responsibility to have a cadre of volunteers and to train them appropriately in preparation. Hopefully they don't need them, but in preparation for any additional services or staffing that they may need. Most of what 211 is doing right now, if necessary, they go very quickly remote. This is something that's relatively new. Usually a contact center is a stationary place where you have a lot of people sitting in a room together. But now virtually all 211s have been faced with the need to equip all of their resource specialists and their data specialists and their administrative staff with the technology to take home so that they can work from home. The phone systems that we use for 211s across the United States are highly sophisticated phone systems. They're also extremely expensive, but they're able to do this kind of work where you can throw phone switches and you can have people in a queue and phone incoming contacts or incoming texts can happen. So much of this remote work is allowed by the technology that we have available today. So we don't have on a local level, to answer the person's question, we don't have on a local level a direct need for the volunteers. The need would come for 211 Heart of Florida covering our area. They would bring in additional volunteers if needed.
Okay, thank you. The next question is, does 211 or will 211 refer women to Planned Parenthood?
I apologize, could you repeat?
Will 211 refer women to Planned Parenthood?
I believe that I can't say for 100% sure. It's the choice of the agency to determine whether they want to participate in the 211 database or not. 211 creates, all 211s across the United States create their own what they call inclusion exclusion criteria. And typically that criteria oftentimes is sort of based on the not-for-profit world. So a lot of 211s don't carry any for-profit resources unless that for-profit is offering something for free in the realm of health and human services, or they are offering something on a sliding scale based on the ability to pay. And typically that would be some of the criteria. So it's usually the choice of an agency if they are interested in participating, because once an agency says, yes, I would like to be in the 211 database, then the 211 specialists in the contact center or working remotely, texting, chatting, on the phones, they were going to be making referrals to that organization. So the organization has to be prepared for with capacity and to accept the volume of possible incoming referrals for service.
Okay. We were, and several of us in the league were surprised that we actually didn't know about 211. So we've been pleased to learn about it, to get this information and be able to continue to pass that information on. Do you have any idea what the primary way is that callers or people find out about the 211 service?
Well, I'm happy to say that just recently we've had a fairly large campaign to make our residents more aware of the service. I would like to thank the Women's League of Women's Voters for the assistance that they have been willing to give us with the passing of these 211 RAC cards. That was, I can't tell you from my heart, was greatly appreciated. We've also been able to share our information with our schools, both in Manatee and Sarasota counties. So we know that each administrative office within the school district has 211 RAC cards available. And we've been able to put up a PDF, a 211 PDF, a digital PDF on Peachjar in both counties, in both Manatee and Sarasota counties, so that parents will realize that this service, this free service, is available. It's also can be, it's a very confidential service, and it also can be anonymous. So oftentimes the contact specialist, the resource specialist, are working with an individual who may reveal to them information that they might not speak of with their friends or their family, or not be ready to reveal to friends and family. And they're able to talk with a resource specialist. Consider this as a 24/7 service, so day or night. And now that we have able to offer a number of media platforms, meaning they can do it either by call or by text or by chat, or they can do their own online search, it makes it really easy for individuals to kind of find out about information that they're seeking. And I think that's a really important part of the service. It can be anonymous. Of course, if a resource specialist feels that someone is in specific, perhaps danger, either to themselves or they could be dangerous for someone else, that would be a call that a resource specialist would have certain protocol for, a special protocol for. So every 211 center is ready and trains to be prepared for those types of protocols, because 211 contact centers can get a variety of different types of calls where people are revealing certain things to them. So there's special training that goes on behind the scenes for that. And those types of calls where there may be the possibility of harm to oneself or to someone else are usually taken by multiple people, meaning you have the resource specialist who's trained on the phone, and then you have a supervisor, a manager, or a director who's also with that person as supportive assistance to carry that person and the person that's on the other end of the call to a positive outcome.
Thank you. Now, once a caller has been given information, is there any way you have to follow up whether they have taken that information and acted on it? It's a follow-up question if there's any way that you know that that happens.
Yes, keep in mind that 211 is a service for the person who's contacting. So they have the controls and they tell the 211 contact specialist, the resource specialist, or the navigator on the other end of the line, just exactly what they need for them to do. And then with permission, they allow the specialist to perhaps give additional resources. But we want to have the person that's doing the contacting feel in control of the situation and control of the moment when they're reaching out for services and for help. And we do follow-ups. 211 Heart of Florida, some of these follow-ups, first of all, are done with permission. In other words, it's typically asked, would you allow for a follow-up? If it's a concern where there's a safety concern or another type of concern, a specialized concern, then it would be a one-on-one direct follow-up with permission. Otherwise, there perhaps could be an at random sort of text follow-up, a bit of a survey where there are maybe 3 or 4 questions that are text to the person's phone to find out whether they received the service they were referred to, whether the interaction with the agency that they were referred to was appropriate, or if they had any concerns about the interaction, and if they had any other questions that perhaps have come up in the meantime, that they should feel free to do another contact with the 211. So yes, there's typically a survey now that gets texted to the phone that someone can fill out quickly, because most of our individuals are residents that are calling for services. Many of them are under a lot of stress. A lot of our calls right now, especially, are either health or financially motivated calls, and it creates a lot of stress for families. So we don't want to burden them with a lot of follow-up, a lot of questions, but we do want to make sure that the services that they're being referred to are fulfilling their obligations on their end to deliver as best they can.
Thank you. That was very clear. Thank you. You mentioned that there are translation services, I think over 150 languages. But the specific question here is there a website in Spanish? The one, of course, you're showing us is in English, because
Yes,
most
I
people
believe.
probably speak English.
Yes, exactly. I believe that you have the ability to toggle over. My understanding is at least into a second language, one that we use quite often, which would be Spanish. So you can actually, I believe, toggle over from our website from English to Spanish.
One question is, do you recommend that children and teens know about this service? You did mention schools, so I think that's the answer is yes. But the question is, do you recommend children and teens know about this service?
Well, our primary focus in our contact with the schools, and we sort of allowed the district to sort of funnel the information appropriately, was to the parents, so that the parents would be aware of the service. I believe that for some of our youth, a certain age category, 211 would be appropriate. For our younger children, it would be something where the resource or the contact specialist, the navigator or the resource specialist would probably ask to have or to speak with the parent.
Another question, and this is actually from Alice. We could, if it's all right with you, we could actually have Alice share her screen to show the website and all the agencies there, particularly with regard to women's health, but you would need to stop sharing your screen. Would that be okay? And she would
Yes,
show.
of course. There we go.
There we go.
Good. Let me do my screen share here, and here we go. Share. So I came to the website, the 211 one here, and as I scroll down, there are these series of issues: housing, food, physical health, mental health, community services, children, elder care. So I figured women's health, let's say I'm 17 and I don't want my parents to know I want to get birth control. I can click on physical health, and there we go. And then you can see women's health services and family planning. You click on that and it's got subcategories. So it has abortions, birth control, crisis pregnancy hotlines. So it's got all of them covered. So even if somebody didn't call in to get, on the 211 line, right here on the website, I can go click on birth control and you can see all these agencies here, including Planned Parenthood. So it is in there. Planned Parenthood, here's Fort Myers, Sarasota's down here, I saw it. At any rate, so any of the issues that are covered by 211, you can go directly to the resource that you'd like to find. So I just thought that might be real, it's got maps, it's got going directly to their website. So anyway.
And it very clearly showed how comprehensive it was, the site is, but also how comprehensive and easy to follow if you have any ability to get to the website. So it really underscores everything that
Right.
Christina said is available through the service.
Yeah, and so.
Alice, yes, thank you for going back. If you hit whoops, can we go up a
I'm
little bit?
scrolling down. So there's the grab and go lunches for teens and things like that. But at any rate.
Yes,
if
if you could hit the search for services bar.
I went to a specific one. I went down here to these.
Yes, if you wouldn't mind hitting the search for services bar for me.
Right here. So this is just
Yes,
a
thank
for all of them.
There we
Yeah.
go.
It's going to get there. There we go.
There we go.
I put my zip code in. Okay, I'm going to
So
put.
you can actually put your zip code in and your county, and then you can search by guided search by the
I'm going to put my age. I'm
keyword
25
or your
again.
specific agency or program name.
Yeah. So, then there's the top 20 services. Oh my, COVID-19. So, okay, that's great because you can really target. Let's see if I'm 25 and in 34209 and I'm female, what are my top 20 services?
For some reason, even though it's you put in the zip code, it's asking also for the city.
Oh, okay. Right. Oh, I see. There's 2 cities that it could be. Thank you for pointing that out. I thought my internet was failing me. So the first category, believe it or not, this you could play with this for hours. The first category, believe it or not, is rent assistant for a 25-year-old female around where I am. Electric service payment assistant.
And you notice actually it's sorted. It's been updated to sort by the most frequent search in recent history. So rental payment assistance has been the most significant search or request that people have been making. So it's sorted in that order.
You could play with this for a while because if you look at that, and it gives you the number of searches so that you can see, well, here it dropped way off or something like that. By the time you're down to mortgage payment assistance, it's pretty small. Let's go back and be totally ridiculous here. And I'm going to change it to somebody 75. Top 10 searches.
I will say there is for our seniors, the Area Agency on Aging, and they have their own contact center, and they have their own resource database for seniors. Now, 211 does carry some resources for seniors, and one of the main referrals that we make for seniors who are calling, needing a multitude of service, would be to the Area Agency on Aging. Now, that's for Sarasota County, and then Manatee County has its elder services as well. So that's a bit of a separate a separate service for our seniors. I do see a question coming up. You have the ability at 211.org, which is another website. That's the national, that's run by the United Way Worldwide. It's called 211.org. And you can look up any 211 service in the United States by putting in, I believe they still run it by zip code, by putting in the zip code of the area of your relative or your friend. We receive a lot of calls from family members here in Sarasota and Manatee trying to help someone, a relative or a friend that lives in Ohio or in Oregon, doesn't matter where. As long as it has a 211 contact center, then we're able to make that referral. We're able to give them that information.
Great. And Alice, Barbara Rowe points out that when you were in the area or on the main sheet, on the upper right, there's a select language button.
Yes.
So it's if you can, if anyone can at least
Yeah.
get on the site and see that.
There, what the trouble is, people's faces are covering it on my screen.
Yeah.
Also, if you'll notice center page, we did this specifically when our 211 Funders Collaborative asked us to have a local website presence. I asked for a singular page and to try to get everything of most importance on that one front page, so that it didn't complicate the situation for anyone. We do carry a disaster services page in order to connect with the EOCs in the case of a weather event. If Alice were to able to scroll down middle page, you'll also see the tab or the button for 211 counts right here, the counts dashboard. And if she were to click on that, it will bring up the live dashboard where you can actually start to review the needs. This is a needs dashboard. So how many people needed rent? How many people needed a water bill paid? So you can, at the very top, it says choose your data to display. There's a drop down. You can run it by zip code. You can run it by county, and you can run a customized search. It says last 365 days. You can break that down and run it for the last 7 days for your county, and it will reset it and will bring up the needs that were requested within that time frame. So it's a really neat dashboard to get a general idea of what's going on in your region.
Thank you. Wow, this was fun, Alice, to have you offer to show us the website.
Yes, thank you, thank you, Alice. I'm happy to take over the reins if you need for me to. Thank you very much for doing this.
But Christina, we don't have any other questions in the chat. You have covered this beautifully. I am still so pleased and amazed. This is actually a service that's there and it works. I will admit to you, Christina, that 4 members of my healthcare committee actually volunteered to call 211 with a question, just to be sure about wait times and what they were advised. And so we didn't feel like we had flooded you with unnecessary calls, but in all 4 of those instances, the call was answered in under 5 minutes, and the response we felt was a very reasonable response to the question that we had asked. So from our perspective, 211 really does work, and you have done a marvelous job of helping educate us. And we continue to have information about 211 on our league website. And we will certainly be posting this recording to our website. People do frequently, I mean, not thousands of people, but almost every video that we post gets some number of views. So we're continuing to now, oh, another question did come in. Let's see it.
Okay.
The second card call.
I'm wondering, are we getting any more 211 cards? Jim Bruin is talking about panhandlers being encouraged to hand them a 211 card, which there's sort of a, I'm not sure they'd use it, but we have been distributing 211 cards. Are we going to be getting any more?
Well, I need to survey the people who help distribute the cards to see whether we want to request more. So I'm going to ask that of the people who have helped and see if we think we have more places that we can think of. Christina, one of those that came as a suggestion was to go to laundromats. And so 2 of us went to 14 different laundromats in the Bradenton, Palmetto area and posted the cards. But the well, let's see, Al, the question was, should we encourage people if they're to give a 211 card to panhandlers instead of a donation? But that also means we'd have to have more cards and distribute them to our membership. But is that a thought that you would encourage, Christina?
It was a special project initially, and it was a project that we had in Manatee County. And it initiated, I believe, the initial request, it goes back a little while. The initial request, I believe, came from the previous leadership at Turning Points. And it was a collaborative between Turning Points, I believe, and the police department at the time. So I don't know where that stands now, but we definitely have marketing material if that were to sort of be revisited. The idea of distribution of those cards, we definitely have enough marketing material to take care of that.
Then I'll let Jim know. I'll follow up with you and Turning Points and see if we need to request more cards or what the status of that initiative is.
Okay, wonderful. Thank you so much for that.
I don't know, can you hear me?
Yes.
Am I unmuted? I know on the two cards I referred to, on the one, the back was in Spanish as well as in English, which
Yes,
I think is very handy to hand out to folks. And the second, the one that was used by the police and supported by Turning Points, on that card, it had, if you're handing it to a homeless person, it was an invitation to come for a meal. So, I mean, you could, and it had the address of it. It gave the address of Turning Points, and it gave the hours that, you know, meals would be provided, which they are 364 days a year. And I think in general, and Turning Points and others serving the homeless would discourage giving contributions to panhandling. It only kind of encourages it, but you know, you can feel guilty about doing nothing as they approach your window. Thank you.
Mhm. Thank you, Jim, for clarifying that. Yes, excellent. Okay, well, the chat function worked really well in terms of being able to have people ask questions. I am not at this point seeing any other questions, so I think we will go ahead and close out this very informative session and all the information you provided us, Christina. We're very appreciative, and we will continue to keep this information available on our website and on our YouTube channel.
thank you, Ruth. Thank everyone. I'm very appreciative of the time that you allowed me today and for all of your support. It's very kind of all of you. Thank you very much.
And thank